Okay. Good afternoon. My name's Todd Bello. I'm the founder of Overcoming Psoriasis, and today we have Dr. Emma Spicer, and she's a podiatrist, and we're going to just discuss some of the things that can help our psoriasis and psoriatic arthritis. Now, we don't normally go to a podiatrist for psoriasis or psoriatic arthritis, but from what I'm reading, podiatrists, correct me if I'm wrong, Emma, can diagnose psoriasis. Is that true?
Yeah, definitely true. We're probably one of the key people that help diagnose psoriasis. Anything to do with the lower limb, a podiatrist can come and help you with. So whether it's psoriatic nails, whether it's the cracked skin on your heels, whether it's the arthritis, we can definitely help diagnose it.
Yeah. So from my experience, I went to a podiatrist and I was diagnosed with plantar fasciitis. Correct me if I'm saying it wrong, but it was very painful. And I didn't have nail symptoms per se at the time, but I did have swelling and sausage toes, I guess you would call it.
Yeah.
So she didn't really pick up on, because I did have a lot of skin issues. And is that a leading indication that somebody might be experiencing psoriatic arthritis along with plantar fasciitis?
Normally it's toenail involvement and psoriasis or psoriatic arthritis, but skin, anything that connects the two, yeah, if you've got psoriasis, I'd still be in the back of my mind thinking, have we got psoriatic arthritis? Have we got just straight plantar fasciitis? It would still be in the back of my mind to make sure that we, cross that off the list. So it's definitely, just because you get psoriasis, you can have psoriatic arthritis years and years later. So it's not, just because you don't get the two together doesn't mean that you can't get it later on.
Yeah, and from what I've read, that podiatrists can also prescribe and diagnose treatments for psoriatic arthritis along with plantar fasciitis. What are some of the things that you would prescribe to somebody that's psoriatic arthritis?
So we would normally do a footwear. We would start you off in some nice comfy footwear, depending on what activities you want to do. Like if you wanted to go out and walk marathons, we'd get you into some nice footwear for that. We'd look at offloading. So particularly if you've got like a sore big toe or a sore heel, we'd try and get you into some orthotics and things like that to try and offload those areas so that you're not in so much pain. And we'd just try and help you get back to the activity that you want to do. So whether it's, walking miles, whether it's swimming at the beach, we'll just try and help you get back to the activities you want to do. We don't necessarily prescribe medications. They're more for what your rheumatologist and things like that would do for you. But we would definitely prescribe orthotics and mechanical treatments to help you out there, plus creams and stuff like that for the skin complaints.
So when you're seeing symptoms of psoriatic arthritis, you might call in a rheumatologist for the patient?
Yeah, we'd definitely do a rheumatologist and a dermatologist for the patient. And it seems a bit weird, but I also would call in, get you to see a psychologist. I tend to find that, I'm a psoriasis sufferer as well, which is probably why I, look, are you surprised? Yep, totally have psoriasis. Mine's in my scalp, so not on my feet, but mine's on the scalp. So I just tend to find if people's anxiety and mental health is taken care of, you have less flare-ups of psoriasis. So I also think that that's an important area to address as well. You have your rheumatologist, but definitely others as well.
I find that if my doctor, who also has psoriasis or psoriatic arthritis, would probably be more compassionate towards me. So I would think that's the doctor that I would want to go to. So
well, I probably know more about it. Yeah.
Yeah. unless you have it, you really don't know the pains and all the things about psoriasis and psoriatic arthritis. So it's good to, go to somebody that really is knowledgeable about psoriasis. So that's a plus if you have a doctor that has psoriasis or psoriatic arthritis. And I know a lot of patients are misdiagnosed with nail fungus and stuff like that. Do you have other colleagues that maybe ask you about psoriasis? Let's say, I have this patient that maybe are they suffering with psoriatic arthritis, psoriasis, or is it nail fungus? Do you get that a lot?
We do get that a lot. I would normally say a 3-strike rule. The testing that we use isn't particularly specific to fungus or psoriasis. So we'll take nail samples in a sequence of 3 times. And if it comes back negative 3 times for fungus, then I can conclusively say you probably have psoriatic nails, because they do look really similar. And the good and bad news is there's nothing we can do about psoriasis in your toenails. We make them look prettier. You can cover them up with nail polish, but that's about it. Whereas the medication for fungus is pretty ruthless. You don't want to go on it if you don't have to. So yeah, the more you can steer away from that, the better off you're going to be.
Yeah, you mentioned orthotics, and my doctor absolutely gave me footwear for orthotics, and I now know better to wear supportive shoes. You recommend supportive shoes, and how about socks? What would you recommend for socks? I know they say maybe wool socks because it wicks away the sweat from your feet, but what would you suggest?
Any real natural fibered socks. So whether it's like, we've got a big craze of bamboo socks at the moment. So whether it's bamboo, wool, cotton, anything like that will wick away sweat and absorb sweat. And when the foot gets too sweaty, the skin gets, when you leave a Band-Aid on for too long, and the skin gets all white and soggy, which means that the skin can split open and be painful. So we're a bit like Goldilocks. We don't want you to have too moist feet or too dry feet. We want you to be in the middle. So if you can wear socks that are natural fibered rather than a synthetic blend, that's probably where we want you to go rather than anything else. And yeah, you've got your circulation socks, which have less elastic at the top so that they don't cut into your legs. You have all those type of socks, but the best I could say to you would be do the natural fiber, spend that extra $5 or $10 and do natural fibers.
So let's say I'm getting dressed up, I'm going out, and I'm wearing my high heels. Would you say?
Each to their own.
You never know these days. No, I'm just saying. What a lot of I've read that it's not conclusive, or how would you say it? It's not advantageous to wear heels with plantar fasciitis or psoriatic arthritis. And what about open shoes? I mean, for women, I'm just addressing the women wear these heels and open.
Look, I'm the podiatrist that says choose a shoe for the occasion. So if you're going to a wedding, have an extra glass of champagne and wear your high heels. That's going to be fine for the night. Just don't wear it for a 10K hike. Just don't wear open shoes, if you're going to, walk into town and back. Wear your sport shoes, wear your supportive shoes. But for a one-off to match your outfit, wear whatever you like. Wear a 6-inch stiletto. Just know that you might have some consequences at the end. So you might have a bit more pain the next day as well as a hangover. You'll just compromise with what you're prepared to do. So yeah, key is choose the shoe for the occasion rather than just, don't sacrifice everything just to make yourself, look best.
Yeah. And also people with history of psoriasis and psoriatic arthritis who comes in with plantar fasciitis, I would think that would be a good indication of that it might be, psoriatic arthritis for you. I'm sure you ask the patient whether they have a history in the family. Is that correct?
Yeah, look, it is so for me personally, my mother suffers from psoriasis, so, goes down the line. So yeah, I always do ask family history, and also if anything in terms of stress or anything has flared up, it's not a given that if you've got heel pain and psoriasis that it's arthritic, but it's more about the history, like more about, have you gone walking in your high heels for a long time, or have you just started up running, or, you know, so it's all about the history as well as like your medical conditions. It's not a given, but it definitely is in the background.
And getting back to the medications, I know a lot of people, I mean, you could rub like Bengay or something like that on it, but let's get more into like NSAIDs or DMARDs. Do you recommend, or would you prescribe those medications?
Well, as podiatrists, we're not allowed to prescribe as such those NSAIDs or DMARDs. Like we could tell you to use some ibuprofen and things like that, as long as you didn't have any gut issues. But in all honesty, your rheumatologist is the best person, or your GP is the best person to handle all of the medication sides. They know what's going on in your history. They can check your bloods. We can't prescribe blood tests. So they're the best person to connect the whole puzzle together in terms of medications.
And systemic, well, injections, steroidal injections. Do you do that in the office?
There are definitely podiatrists that do corticosteroid injections.
Mm-hmm.
If you had psoriasis, again, I probably would do it in a like restricted setting. Like I'd do it if you had an acute situation, but corticosteroids used incorrectly in some tendon areas can make problems worse long term. Like it might get you out of pain for the short term, but long term it has its side effects. So again, your rheumatologist, your GP, I think are best to suit that. Also, these days you can get injections done under ultrasound, so they can target the exact area where you're having the pain and get the injection site correct. Whereas sometimes if you don't have that technology available, you don't quite know the right spot. So we can definitely do it. Would I do it on a routine basis? No, I'd refer you off.
Yeah, I remember my doctor was saying that I can only, I think it was 4 shots per year. Correct me if I'm wrong, but yeah, she really, with steroidal injections, you can't go more than, because like you said, there's adverse reactions to it, and it could make matters worse.
Yeah.
So, and what about athlete's foot? I mean, a lot of people might be misdiagnosed with like athlete's foot. I mean, has that ever come across your desk?
Yeah, look, the psoriatic plaque-like lesions in athlete's foot can look similar, and they can itch and look the same. We can take skin scrapings to try and differentiate the two, but also it comes down to a bit of history. Like if you do have the family history of psoriasis or nail involvement, or you'll tend to find athlete's foot hangs out in between toes more, and it tends to have more like red pustule-like lesions, where psoriasis tends to like be plaque-like, so it tends to have lots of layers and things like that. But you're right, it does look similar. So you do sometimes go, all right, we'll treat you with this first, the antifungals first, and if it doesn't work, then we'll reevaluate. But it does come down to history a lot. Like if you go, does mum or dad or grandpa or grandma have anything that looks like this? And they'll go, yeah, on their knees and elbows. And you go, all right, time to get tested for psoriasis. So yeah, it's about history rather than like the whole picture, not just one thing.
Yeah, and how often do you perform like a biopsy? I mean,
we do skin scrapings. Well, it's not really a biopsy, but yeah, we'll do skin scrapings or nail tests like on 2 to 3 patients a day. It's not uncommon, and it doesn't hurt. It's just a scraping.
Yeah, I had a skin biopsy done, a punch biopsy. It wasn't fun.
Yeah, no, it's nothing like that. That's for like very different things. Nothing like that.
So when you do like a scraping, do you look in your office for under the microscope, or do you send it out to a lab?
You would send it out to a lab. Yeah.
Do you know what they look for, or is it like?
To be honest, no. I mean, there are certain fungal components, so like your tryptorubins and stuff like that, they would look for in a fungal. But I don't know. I mean, psoriasis is just like your dead skin cells not flaking off. Like everyone flakes off their dead skin cells. But the autoimmune process of not getting rid of that dead skin is kind of the underlying factor of psoriasis. But I'm not sure what they would look at under a microscope in terms of that, like what exactly they'd look for.
I'm curious why you would want to be a podiatrist. I think a lot of people would steer away from being a podiatrist, but I just
it's not particularly glamorous, but all my family are in health, so I wanted to do something health related, but nothing they were doing. So I gave podiatry a go and ended up liking it. So yeah, I'm not one of those people that are good behind the desk. I'm more into talking to people and face to face rather than anything else.
That's wonderful that you're able to help people. And because I experience pain pretty much every day when I first get out of bed, so like my ankles will give me a little bit of pain, but then as I walk through it, it kind of like warms up and the pain subsides. But I know when I had that plantar fasciitis during that time, I had to stretch out. Like I was leaning against the wall with my elbows. My doctor told me to stretch, and then kind of get my calves stretched out too. And do you often see like Achilles, what do they call that, Achilles tendon pulls or tear?
Yeah, we see it. Actually, the person I just had before had it. Yeah, we see it a lot. It's a common injury, particularly in runners, not necessarily psoriasis sufferers, that can be, but side issue. But we see it a lot. Yeah, so it's stretching, orthotics, try to reduce activity, heal this. There's lots of different treatments that can help get people back into their activity. But yeah. It's super common and super hard to get rid of, actually.
Yeah, that's I know my brother had an Achilles tendon tear, and that took like 6 months for him to, and then and then physical therapy on top of that, right? So yeah, that was you have to reattach it, right?
Yeah, often it can involve surgery. Yeah, it depends on the level of the tear.
Yeah. So what I also which I recommended to people in the group was these new sandals or flip-flops that I bought, and they're called UFOs. I don't know if you're familiar with UFOs.
No.
So spongy and comfortable and offer a lot of support. And my ankle was turning in on my right, and it was all swollen on my ankle side and really bad. And I have to contribute the healing, I guess, from those flip flops because I wear them quite often. And I also bought here in the USA, I bought Brooks sneakers, which is an athletic shoe. But you have them there in Australia?
Yeah, definitely love Brooks. They're one of our faves. Yeah.
Yeah. So when I went into buy the footwear, actually my girlfriend said you have to go and get supportive footwear, and I ended up spending like $300 on the shoes plus the flip flops. But anyway, I really contribute the healing, and my foot isn't as swollen anymore due to the really good footwear. So that's what I find that I recommend that to the people in our group, overcoming psoriasis. So, yeah, they're just so comfortable. It's like walking on a cloud.
Look, on a whole, we as podiatrists, we don't love flip flops, but the concept is good. Like, love the Brooks. Don't necessarily love spending lots of time in flip flops because it creates like the clawing of your toes and stuff like that. But without seeing the shoe, I can't say whether it's good or bad. But in terms of flip flops here in Australia, we tend to recommend things like Birkenstocks, things like that. But yeah, like, I'd love you in your Brooks more than your flip flops. If you were my patient, you'd be in your Brooks more.
Yeah, so even with the Brooks, he took the inner lining out, and then he put like an orthotic in there.
Yeah.
So, but I still have them. They're in great shape, and and I had to replace the flip flops because I wear them pretty much all the time. So, but especially around the house, when I'm walking on the hardwood floors, because all the carpeting, most people remove carpeting from their homes due to allergies and stuff like that. Especially me, I removed all the carpeting and stuff because I thought that was contributing to my psoriasis, and I just wanted to eliminate the variables. So I went to hardwood floors and stuff, but the hardwood floors and the tile floors, that actually is harder on your feet, would you say?
Pretty unforgiving, that type of flooring. And then
Yeah.
I would go, yes, your thongs and your flip flops are better than like slippers and bare feet. So yeah, you've got to pass a hall pass for the thongs
Yeah.
around the house.
Yeah, so that's pretty much. I have so many other things I could talk about, but I know you're on lunch break, and I thank you so much for taking time out of your day to talk to us. I was just wondering if you had anything to add, maybe to a recommendation for patients that might be on the fence with going to a podiatrist as opposed to a rheumatologist and a dermatologist.
Look, I would say choose any one of them. Just if you're suffering with psoriasis, get help, because there's definitely treatments out there. Like me personally, with mine in my scalp, I ended up cutting a fringe into my hair at one point to hide it. And the idea is it doesn't go away. It's just a condition that you've got living with, and any amount of help is out there. So whether it's podiatrist, rheumatologist, dermatologist, just don't hide it away, because it doesn't work. Just go get help.
Yeah, I agree. And if that, like you said, the help is out there, and somebody like myself who was severe, I had psoriasis from head to toe. I was covered in it, and it's not very comfortable to go out in public and have people staring at you and flakes. They used to call me. They had a nickname for me at work, and it was called Pecorino, because the flakes were coming off. And the other thing about you have scalp psoriasis, so like I noticed you're wearing black. I would never wear black because like the flakes would come down onto my black shirt and you would be like a snowstorm. But I was severe, like I said, and behind my ears and everything. But today, like you said, if you go get the help, it's out there, the support's out there, and there's medications out there that can have you all fixed up in like 3 weeks, 2 weeks maybe. But like I said, thank you so much. I don't want to run over. I think it's 8:32 now. So thank you so much.
Not a problem. Lovely to talk with you.
Yep. And God bless.